They are the body's detoxification and blood particle processing units, two bean-shaped fist-sized masses just below the rib cage, either side of the spine. At least for those of us fortunate not to have lost one. Crucially, kidneys filter and at the same time process the blood. If they're healthy, they're cleaning half a cup of blood a minute, keeping what's needed, like nutrients from food, expelling what's not needed, like excess acid, protein, and fluid, which are piped off to the bladder to be passed from the body as urine. And in performing its inventory of what's needed and what's not needed in blood, it's also working to replenish low stocks, making glucose if sugar is low, making erythropoietin to stimulate red blood cell production if oxygen's low. So you can imagine the kind of disorder that ensues when kidneys are compromised, as is manifest in chronic kidney disease, or CKD. Today, best-selling author of the Diabetes Code, Dr. Jason Fung gives a kidney health specialist's breakdown of CKD, including how kidneys change with this disease, how it's diagnosed, its major causes, high-risk foods for CKD, and how the condition's treated. And specifically, on the treatment side, we highlight a traditional Chinese medicine formula for CKD that could well be a barrier to kidney damage. Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brendon Fallon. Dr. Fung, a pleasure to have you join us on Vital Signs again.
Thank you. Thank you for having me.
To set the scene for our conversation, Dr. Fung, I'll take it back to my childhood and to my friend whose mother was obviously, from her appearance, the way she moved, unhealthy, and she would disappear off into her bedroom for 3 to 4 hours at a time and be hooked up to this machine, which I later learned through my mother, who was a nurse, that she was having kidney dialysis. Understanding that this is the severe end of the spectrum of kidney failure, of kidney disease, I'm delighted to have you on today to talk about what can be done in the stages before that to reduce kidney damage and even improve health in the contexts of chronic kidney disease. What is the starting point to this condition?
Yeah, so in terms of kidney disease, there's a lot of things that can cause kidney disease. Kidney function over time gets worse as you get older, but for most people, they have enough kidney function left to at least stay off of dialysis. However, what it does, the kidneys, it cleans the blood basically. So when the kidneys don't clean the blood, then you get all these signs and symptoms when the blood gets very dirty, and it's called the dwindles because people feel that they're just sort of weaker, more tired, can't do anything, lack motivation, then they lose their appetite. And it's very non-specific. There's lots of things can cause that. However, this is the only signs we often have of chronic kidney disease, which is why it's really important to sort of check your blood work, get routine testing so that you know if your kidneys are going down. Because you could lose 90+% of your kidney function without even knowing it. Then every once in a while we get somebody who rolls in with chronic kidney disease and they're at the extreme already. So you want to, of course, intervene well before that, because once you get to that stage close to dialysis, you really can't do anything about it because the kidneys have been destroyed and there's nothing you can do. But if you catch it early enough, you can figure out what's causing the damage and try to sort of reduce it or slow it down, or even now potentially reverse it a little bit. And that's where it's really important to have that early detection. And also knowing what diseases commonly cause kidney disease. So if you have those diseases, then you can monitor it. So the two biggest ones by far are going to be high blood pressure and diabetes.
Just earlier, you mentioned diabetes as a condition that can lead to CKD. I know that diabetes is primarily diagnosed as an excess of glucose in the blood. What beyond that in testing would lead to a diagnosis of chronic kidney disease?
Well, you have to do a test. Usually they're called the creatinine. So it's a blood test. And creatinine itself is not a toxic substance, but it's excreted sort of fairly substantially by the kidneys. So when the kidneys aren't working to get rid of the creatinine in the blood goes up. So you measure it and you see this elevated blood creatinine. And that's when you know you have kidney disease. The other thing is to do a urine test, because if you start seeing large amounts of protein in the urine, then you also know that you're developing kidney disease. So a blood test and a urine test. And the idea is, again, Sometimes people get protein in the urine and think, oh, well, maybe I'm eating too much protein. That's not it at all. The kidneys, what they do is they act sort of like a sieve. So if you think about when you're washing blueberries in the sink, for example, you put it in a sieve or a colander, and then the water goes through into the sink. The blueberries stay in the colander so that you can eat them. The same thing with the kidneys. So the kidneys, they basically let all the urine through, but they keep all the protein inside because you don't really want to lose that protein. That's precious stuff. So you should really have very, very little protein in the urine in a normal situation. If you start seeing blueberries in the sink, there's nothing wrong with the blueberries and there's nothing wrong with the sink. The problem is that you have a big hole in your sieve, right? That's letting those blueberries fall through. And it's the same thing with the kidney. So when you start seeing protein in the urine, it doesn't mean that you're eating too much or too little or the wrong protein. What it means is that your kidney has a big hole in it that's allowing that protein to fall through. And that's often the earliest sign that you'll have kidney disease, even before the blood tests become abnormal. Because by the time the blood tests get abnormal, you've already sustained a significant amount of damage to the function of that kidney, because the kidney is not cleaning properly. So you're already at 50, 60% damage to the kidneys by the time you see it in the blood. So that's why it's important to do the blood test and the urine test. And they're fairly routine. So when you do a typical sort of, yearly checkup, the kidney function is often included in that. Urine tests will often pick it up as well. So that's the sort of yearly sort of wellness check that a lot of people do. It's important to do that because it's on those routine screens and you'll be able to pick it up early. For blood pressure, of course, it's about monitoring your blood pressure. So these days it's a lot easier. 20, 30 years ago, you had to go to your doctor to get your blood pressure checked. Now, of course, there's a ton of home monitors, which is a pretty good idea, but there's also monitors at a lot of pharmacies all over. You just go there, you sit down, you check your blood pressure. It's free. There's no needles. It's non-invasive. So it's really important to check your blood pressure routinely. Like, not that it's a problem, but it fluctuates all the time. So therefore, if one reading is high or normal, it doesn't mean the next reading won't be, normal or high, right? So it's important to check it. So blood work, urine tests, and blood pressure are probably the most important things, and they're easy to do.
The situation you described of having these holes in the kidney, is this a consequence often of the elevated glucose in the blood? Is it basically toxicity of too much sugar that's damaging the kidney?
Yeah, in the case of type 2 diabetes, or in the case of diabetes, yes. But there's lots of different things that can cause it. The most important would be high blood pressure and diabetes. Diabetes typically causes a lot of protein in the urine. High blood pressure does not. There's other diseases as well, glomerulonephritis. These are rarer diseases, polycystic kidney disease. So any of the kidney diseases can cause it, this protein in the urine. So it doesn't mean you have diabetic kidney disease. It means you have kidney disease, of which the most common would be high blood pressure and diabetes.
What kind of physical symptoms might people experience? You mentioned some, like a kind of fatigue being a factor in this. What kind of signs might they see in their body that they're heading towards having a kidney disease?
Yeah, so by the time you actually feel it, your kidneys are mostly gone. So that's why you can't really leave it to the symptoms. It's not like a cold where you'll get a fever or a cough and then you'll be able to pick it up sort of quickly. Kidney disease can go on for decades, really, without anybody knowing about it. And often it's picked up just on a routine test. We see people, for example, they get a test for insurance or a test for, work or something like that. And then boom, it's like, whoa, there's a lot of problems here. But they didn't feel it themselves in any way. No change in the urine, no difference in the urine, no anything. And that's typically the case. By the time you get the symptoms, the kidneys are sort of 90-95% gone. And oftentimes by that time, because it's so advanced, it's often irreversible. But the signs and symptoms of the fatigue, the nausea, the vomiting, this sort of sallow complexion, that's when things are really, really, really far gone.
And in terms of medical treatment for CKD, I imagine you'd be focused largely on treating the high blood pressure or the diabetes, being that those are primary causes of CKD.
Yeah, so this is why it's important, because you have to identify what's causing the kidney disease and then take care of what's causing the kidney disease. So in the case of high blood pressure, you want to treat them with high blood pressure pills usually, or diet. And by taking away what's causing the kidney disease, you hope to slow it down. As I said, kidney function declines over time anyway with age. So you almost never stop the decline of kidney disease, but you want to slow it down to what it was before, not this sort of quick decline, but just a slow decline. The other thing is for diabetes, it's just the other major issue. I mean, there are other ones. There's myeloma and there's polycystic kidney disease. There's all kinds of inflammation in the kidney called glomerulonephritis. So those have specific treatments, but they're relatively uncommon and rare. Diabetes is the same thing. Diabetes can cause kidney disease. In fact, it's the most common cause of kidney disease and kidney failure, which leads to dialysis. So just to clarify what dialysis is when your kidneys have basically completely shut down. What we do, because the kidneys normally clean the blood, is we take the blood, we clean it with the artificial machine, the dialysis machine, and then we give it back to the patient. And because the blood will get dirty again, then you have to do this usually 3 times a week so that you keep cleaning the blood. Because as soon as you come off the dialysis, the blood starts to get dirty again, and then that's what happens. So yeah, if you identify the diabetes, then for type 2 diabetes, you have to understand that type 2 diabetes is a reversible condition. So if you can then intervene when they're, before they have a lot of kidney disease, and you reverse the diabetes, then you're going to reverse a lot of the damage, a lot of the sort of accelerated damage that happens with the diabetes to the kidneys, and hopefully, prevent somebody needing dialysis.
And we've talked in the past about different strategies for reversing type 2 diabetes. I'll include a link in the description below and also at the top of the comments so viewers can check that reversing type 2 diabetes video out if they'd like to. In terms of dealing with the high blood pressure cause of CKD, what kind of medical treatment is standard in that case?
So there's the non-pharmacologic and the pharmacologic. So the non-pharmacologic in terms of as in not drugs. Certainly doing more exercise, weight loss, those are probably the most important things. People used to talk about salt restriction in the past, but it's really not that effective. Salt restriction in terms of reducing blood pressure. For some people it is, but it's actually the minority of people that have a huge reduction in blood pressure when they eat less salt. Weight loss is quite effective, and changing the diet to low carbohydrate diets can be very effective. Some people notice that their blood pressures actually drop very significantly on that. So those are a couple of the things that you can do from a non-pharmacologic standpoint. Then from a drug standpoint, there's multiple classes of medications that have been used for decades. At least 6 or 7 different types of classes of medication that can be used for high blood pressure. And they're really quite effective. So for the most part, people can get control of their blood pressures through a combination of non-pharmacologic and pharmacologic measures. The targets have actually changed also for blood pressure in the past. So 20 years ago, the sort of consensus was that blood pressure should be 100 plus age. So this is something that was 25 years ago. So if you're 70, people would say, well, your blood pressure of 170 is okay. It's not okay at all. That's old sort of medicine. So the targets for blood pressure were 140 on the top. So blood pressure there's a top number and a bottom number, right? So it's like normal is 120 over 80. Both numbers are important. So the target for the top number is 140 and the bottom number is 90. So anything, if the top is over 140, then it should be, you need something to bring it down. If the bottom is over 90, then you need something to bring it down. So it's either or. What's the difference between the two? Mostly it's age. So people who are younger, who are less than 55, should really be looking mostly at the bottom number. That's the one that typically is high if they have high blood pressure. People over 55, it typically is the higher number that causes a problem. So that's the difference. The blood pressure for people with kidney disease is even stricter. It's actually 130. So you have to, instead of being under 140, they want it under 130. And again, the other thing is that the blood pressure fluctuates. So if you're under a lot of stress, your blood pressure might go up, for example. So we're only interested in treating it, particularly with drugs, if the blood pressure is sustained high. So if your blood pressure goes up to 150, for example, that's high. But then because it was due to whatever stress you had, and then the next day it's 120, you don't need to treat that. So usually when you initially are looking at the high blood pressure, you should treat it, you should measure it over several periods of time, and usually over 3 to 6 months before you actually start treatment with drugs, because it just might be a temporary thing, right? It's exam period, your pressure's high, but then after exams, then everything goes back to normal. Well, you don't need to treat that. It's only if it's high all the time. That's where it's dangerous.
And is there a particular medication that's favored by nephrologists, kidney health specialists like yourself in treating the high blood pressure?
There's a couple of classes of medication. So in the past, so again, there's been drugs for 50 years, and the old ones that used to be used a lot were the diuretics, which are water pills, and the beta blockers. Because of side effects, that is, they can cause other side effects, most people in the last 20, 30 years have switched over to two classes in particular. One is the ACE inhibitors, which is things like ramipril or perindopril, lisinopril, or this other class called the calcium channel blockers, and those are drugs like amlodipine or Norvasc, for example. So they tend to they're once a day medications compared to some of the older ones, which are twice a day sometimes. And also they tend to have less side effects than the older drugs. So most people use, those drugs right now.
So that's an overview of what's available on the pharmaceutical side for dealing with CKD. I guess more on the natural medicine side, shortly we'll speak to a nephrologist from Taiwan who's the lead researcher of a traditional Chinese medicine formula for CKD called Eefooton. Are you aware of this research on this particular formula, Dr. Fung?
Yeah, the evidence in terms of traditional Chinese medicine there's not a lot of strong evidence. Certainly there's a lot of anecdotes. So people who have used it, there's lots of stories of benefit, and I'm certainly not against any of that. So I think it's worth a try for sure. But for the most part, I do have a lot of patients who have used traditional Chinese medicine, because I have actually a lot of Chinese patients in my practice. The majority of them still require drugs or other things to control their blood pressures, particularly as they get older. It tends to be much more common as you get older, the high blood pressure. So it may be enough at the beginning, but often you may need typical medications at the end too. But they're complementary. There's nothing wrong with using them for the most part. I mean, obviously, you have to know who you're getting it from and so on. But yeah, absolutely. I think that you can certainly use them, but many times it's not enough.
Up ahead, the lead researcher of a herbal extract treatment for CKD, based in traditional Chinese medicine, Dr. Guocheng Lu, shares his team's findings. But first, here's a peek at my interview with Dr. Roger Schwelt revealing how sunlight helps stave off coronavirus and even the common flu.
We spend, at least in the United States, 93% of our lives inside, where we have LED bulbs that give off no infrared light at all. We have windows that on purpose block infrared light coming in, that we are certainly to one extreme of the scale. And so the question is what should we do to counteract this without getting the negative effects of too much sunlight and not enough protection on our skin?
Afterward, find the link to that video at the top of the comments and also in the description below. And you can subscribe for full access to our ever-expanding insights on fine-tuning your health just by hitting the big red button below. Now we're joined by Dr. Guocheng Lu, a nephrologist from Taiwan with 30 years experience in clinical practice and in nephrological research. He's been researching this traditional Chinese medicine treatment formula for CKD, Eefooton. 2 studies he's been the lead researcher on, one published in 2025 and one published at the end of 2024. Dr. Guocheng Lu, welcome to Vital Signs.
Thank you for having me. As we know, chronic kidney disease, CKD, defined by ongoing kidney damage or reduced GFR, means glomerular filtration rate over 3 months. Traditional Chinese medicine, a cost-effective and widely used, is especially popular in Asian countries. Eefooton is a liquid herb blend made from 5 herbs, specifically formulated for CKD. The study evaluated the clinical efforts of the Eefooton in CKD treatment. The study explored how Eefooton could help people with moderate to severe CKD. In one study, 75 patients with stage 3 to stage 5 CKD aged 20 to 80 took Eefooton alongside their usual medications for 6 months. The results show significant improvement in kidney functions, especially in early-stage patients with no serious side effects. A second study with a different group and the time frame found similar positive results. Both studies suggest Eefooton could be a safe, effective addition to standard CKD treatment.
And I understand with both these studies, the 2024 one and the 2025 published one, significant results were observed. What were the main effects of this treatment that were seen through these studies?
Our studies show that the Eefooton significantly improved kidney function in CKD patients. After 6 months, EGFR means renal functions. EGFR level with major increase from 22 to 29 in CKD stage 4.
One term you've used there is EGFR, the estimated glomerular filtration rate. Could you explain a little bit about what that is?
It means how many percent of renal function when compared to the young adult, such as if your EGFR around 60 means your renal function roughly equal to 60% renal function of the young adult. If your EGFR is 20, it means your renal functions roughly equal to 20% of the young adult normal renal function.
For these studies, you had patients at stages 3, 4, and 5 of CKD. What is the corresponding EGFR for those different stages of CKD?
In CKD, stage 5 means the EGFR less than 15, and the stage 4 means EGFR from 15 to 30. Stage 3 means EGFR from 30 to 60.
Right. And I imagine if you're at stage 4, if you have, or stage 5, you have such low EGFR, you might be needing dialysis or you might be close to needing dialysis.
Yeah.
Could you say a little bit about what kind of results were seen in patients' EGFR when they were taking this treatment?
Because these two studies have similar results. We found in stage 3B means moderate CKD patients, the patient treated with Eefooton, the EGFR increased from 37 to 50 in stage 3B patients. However, in stage 4, just increase from 22 to 29. So this reflects we should use the Eefooton in patients in early CKD. So the early, the better. The early use, the better.
I understand. Preventative, the earlier they receive the treatment, the better the effect. Would someone in stage 3 CKD, if their EFGR goes from 30-something to 50, would they feel it? Would it make a difference for their health? Would they know the difference?
In stage CKD 3B patients, when using the Eefooton, most of them will improve renal function. However, in stage 3 patients without Eefooton, during the 6 months follow-up, the renal function keep the similar level over the 6 months follow. Even in advanced stage 5 patients, though severely affected, so EGFR rise from 8 to 13, which could delay the need for dialysis and improve daily life. We also observe lower creatinine, better blood pressure, and improved blood glucose and cholesterol.
In this study, I noted that there was a significant drop, a 1% drop in the HbA1c, the hemoglobin level in the blood of patients with stage 4 CKD who had taken the treatment for 3 months. Would you like to highlight that result in the research?
Yes, we find a small group of patients show reduction of hemoglobin A1c. I think it's just reflect the beneficial effect of Eefooton through the anti-inflammation and the antioxidative stress. So we find the decreased hemoglobin A1c levels just in stage 4 patients because these two studies is such a small number of the patient group. So we need a large patient group to further investigate, especially on double-blind, because these two studies are retrospective clinical cohort finding.
So ahead, you're looking to do a double-blind, placebo-controlled study. This is where you have two groups. One group receives the treatment, one group receives a placebo, but neither know whether they've had the treatment or the placebo.
Yeah. Now we are conducting the double-blind RCT trial in Taiwan. The result will be shown maybe 3 or 6 months later.
I understand it's not just one ingredient, but a combination of different traditional Chinese medicine ingredients that would be responsible for producing these effects. What are these specific ingredients, Dr. Lu?
Okay. The powerful effect of Eefooton come from its blend of key herbs. Astragalus means Huangqi improves kidney function by reduce protein loss and fighting oxidative stress. Cotonopsis means Dangsen offers antioxidant and anti-inflammatory benefit, protecting kidney and boosting energy. The third one is Ligustrine. Lucidin means 女贞子, helps prevent kidney scarring or fibrosis. Panax means American ginseng or Xiyangsen, reduce kidney cell damage and helps control blood glucose, crucial for diabetes patients. The last one is the rhodiola, means Hongjintian, protect kidney cells and reduce harmful toxins. Together, these herbs reduce inflammation, protect kidney cells, and improve kidney function.
So the inflammation, the oxidative stress has an effect on the blood glucose. It causes the blood glucose to be higher.
Yeah.
And I was reading that these ingredients, the astragalus, the huangqi, and the C. pilosula, the dangshan, these have an anti-inflammatory and antioxidant effect. Are these the main ingredients that may be reducing the blood glucose or reducing this HbA1c, do you think?
Yeah, because most of the traditional herb medicine always combine with more than 2 or 3 different kind of ingredients. So some ingredient may contribute to more on the inflammation status, some more on the oxidative stress, and some more on the reduced inflammation-induced fibrosis. So the combination of different herb medicine is very important for traditional herb medicine.
It's very interesting that I've heard from other doctors that the problem is with many studies in the past, they just study one ingredient in traditional Chinese medicine, and so it doesn't show many results when really they should be studying them in combination as has happened with these studies.
Also, some components such as Fung have strong anti-fibrosis, reducing kidney scarring. So combination different ingredient in this Eefooton formula can correctly and can enhance the anti-inflammation, antioxidant, and anti-fibrosis effect through different ingredient of Eefooton. The synergistic effect.
I guess it's kind of like a team as opposed to one person. So there's a stronger effect. Could you explain what fibrosis is?
During the CKD progression, chronic inflammation or oxidative stress can elect the fibrosis process that induce kidney scarring. That will shrinkage the kidney size, means the kidney size will decrease in size. Then the kidney lost its function. So prevent inflammation oxidative stress and prevent the inflammation oxidative stress induced fibrosis of kidney is very important. So from the Eefooton clinical trial, we found early use of the Eefooton will provide the biggest beneficial on kidney function preservation.
What you were saying just now, Dr. Lu, in terms of the shrinking of the kidney size, it made me think of the result that came through in the 2025 study that showed actually a slight enlargement of the kidney size from patients taking Eefooton. Can you speak a little bit on that?
Because the oxidative stress and the inflammation can elicit the fibrosis process. The fibrosis can shrinkage the kidney size. The fibrosis not only decreased the kidney size but also lost renal function. So prevent inflammation and oxidative stress in leg fibrosis is very important, especially in early stage CKD patients.
Could you point to the specific data where that shows the kidney increasing in size?
Because during the progression of CKD, the kidney, most of patients, the kidney size will be decreased progressively. However, in patients, especially in early CKD or moderate but not severe CKD, early intervention with anti-inflammation of antioxidant may preserve renal function. From the cellular study, we found the Eefooton can promote the renal tubular cell survival and the proliferation. So from the clinical trial, we found a very small increase the renal size, maybe due to the early anti-inflammation and the antioxidative stress and the prevent fibrosis.
If a person has CKD and they're taking conventional medication, would it be a problem for them to take Eefooton as well? Is there any conflict between taking conventional medicine and taking Eefooton?
Okay, from our clinical study finding, all the patients receive conventional CKD medication alongside with the Eefooton. We don't find any side effects such as skin allergy or GI upset. So I think also we follow the renal function data, liver function test. So I think it's safe, very safe and efficacious in CKD patients.
And even if a patient is on dialysis, it would still be okay for them to take Eefooton?
Because our study focused on the CKD patients not yet receiving dialysis. So I don't know if it's suitable for dialysis patients. At present, I don't think it will be adequate for dialysis patients because we don't have any clinical data.
If I know someone who has CKD, let's say they're at stage 3 CKD, they've been diagnosed, is there some way they can access this treatment?
Yeah.
Would it be available? How could they access it?
Okay, because it's just combine 5 different ingredients of the traditional herb medicine. It can available in Taiwan. However, I think after more study in this formula for CKD patients, maybe 1 or 2 years later, it can be available in other countries.
And you mentioned there will be future trials of Eefooton. If someone is in America and they wanted to take part in one of these trials, would that option be available to them?
Yes, I think if the FDA of the US approve this study, we will conduct the similar clinical trial in US hospital, maybe in the near future.
Thank you so much for joining us today, Dr. Lu, and for giving us this hopeful and exciting news about this treatment and its continued research. We will continue to watch closely and see what comes out of further research into Eefooton.
Okay, thank you. Thank you very much.
We've heard so much about the research results for Eefooton from Dr. Lu, and to stay up to date on further clinical trials of Eefooton, you can go to clinicaltrials.gov and search Eefooton. Up shortly, Dr. Fung will talk about diet and lifestyle methods to prevent kidney disease. But first, here's his take on the decrease in hemoglobin, or HbA1c, in CKD patients shown in the Eefooton research. And Dr. Fung, in terms of this specific traditional Chinese medicine treatment formula for CKD, I noticed that in the study that the patient's HbA1c had dropped by a percentage point. These are patients with stage 4 kidney disease, dropped by a percentage point over a period of 3 months. Is this result considered significant in the scheme of CKD treatments?
Oh, absolutely. Yeah. So an A1C drop of 1% is good, but a lot of people are 2, 3 above, right? So for A1C, which is a measure not of CKD, but of blood sugar control, diet is very, very important. And there are a lot of actually traditional Chinese medicines that do help with that, often by, reducing the appetite or other things. But yeah, absolutely. It's a significant improvement, but sometimes not enough.
We've covered the main things on the conventional medicine side in terms of we've talked about the dialysis, some medications. Are there particular risks involved with being on dialysis?
Yeah, dialysis is not a perfect solution. So the dialysis procedure is a big medical advance. It's a life-sustaining treatment because if you get to the point where your kidneys fail, if you don't do dialysis, you die. So a lot of people say, well, I don't want to do dialysis, to which I always say, nobody wants to do dialysis, right? But at the point that you need the dialysis, your choice is between doing dialysis or dying of kidney failure. It's not like you get to choose any other option. So dialysis is not a perfect solution. So you don't live a normal life. You have to constantly do the dialysis, but even there's tons of problems that come up with the way you do the dialysis. There's problems with the fistulas that you need to do, the blood vessels that you need to access. Sometimes they can clot off, sometimes they can get infected. And then even if you do the dialysis perfectly, it's only cleaning your blood, to a level that you can survive. So it's sort of like, if your kidneys are cleaning the blood normally, 70, 80%, dialysis would be like 10%. So yes, you're not going to die, but it's not normal, not even close to normal. So the dialysis itself, if you look at overall survival on dialysis, it's quite short. On average, this is sort of all patients considered, it's about 4 years. So that means about 1/4 of people are dying every year just from being on dialysis. And of course, the disease that led them to it. So if you have diabetes, if you have high blood pressure, you're not only going to have just kidney disease, but oftentimes you'll have heart disease or something else too.
Just ahead, Dr. Fung paints a picture of what can be done on the diet and lifestyle side to help prevent CKD. But first, here's a glimpse of the powers of sunlight to stave off viral infection.
About 100 years ago, especially in Switzerland, Austria, there were something called tuberculosis sanatoriums where they would take people up to very high altitude, and they noticed that people got better really quickly. It's actually very high energy light coming from the sun.
We hear about so many different antioxidants that can be taken to combat COVID-19 or different infections in general. Where would you say the melatonin that's stimulated through sunlight fits in?
It's at the very top.
And Dr. Roger Schwelt used sunlight to boost critically ill COVID patients' recovery during the pandemic. Afterward, find the link to that video at the top of the comments and also in this video's description below. And to get notice of new Vital Signs videos, follow me at Vital Signs Brendon on Instagram and Facebook, and at Vital Signs on X. Knowing that diet and lifestyle are really central to your focus for managing patients' kidney health, can you give an overview of what can be done on the diet and lifestyle side for managing and preventing chronic kidney disease?
So there's two things. One is in terms of the chronic kidney disease itself. Can anything sort of dietary-wise improve that? There's one, you can look at what's the underlying cause, so high blood pressure, diabetes, and diet's going to make a huge difference for particularly diabetes. And we've discussed before about how it's a reversible disease. Changing your diet to a low carbohydrate diet or doing intermittent fasting can reverse the disease. And if you reverse the disease, then you're not going to have as much kidney damage. So remember that diabetes, type 2 diabetes specifically, is really a disease of too much sugar in the body. And when you have too much sugar in the body, it's going to cause damage to organs such as your kidney. It also causes damage to your heart and to the eyes, and it causes infections because your body's just so packed with sugar. So if you change your diet, that is, you change and cut down the carbohydrates, then you can often reverse diabetes, because remember, carbohydrates are sugar. That's their chemical structure. So if you look at bread or rice or potatoes, they're starchy foods, and starches are chains of glucose. And if you eat potatoes or rice or whatever, especially the refined ones, then you're eating glucose, which means your blood glucose is going to go up. On the other hand, if you eat proteins and fats, say you eat an egg or something like that, well, there's no glucose. It's proteins, which is amino acid, and fat. No glucose. So you're eating protein, you're eating fat, but no glucose, your blood glucose does not go up. Since your body really has just too much glucose, you want to switch from eating a lot of glucose, which is carbs, to eating more proteins and fats. So the whole idea is not that difficult to understand. Your body has too much glucose. That's what type 2 diabetes is. So don't eat so much glucose. We just eat fewer carbohydrates. And, you see this in all kinds of things. Like you can look at the glycemic index, for example, and what you have to understand is that certain foods contain glucose and will raise your blood glucose. And certain foods don't contain glucose and won't raise your blood glucose. Since you have too much glucose in your body and your blood glucose is too high, you should switch to eating those foods that don't raise your blood glucose, right? Not too hard to understand. So low carbohydrate diets and intermittent fasting is another strategy where you can allow your body to burn off some of the excess glucose. So if you don't eat, your body still needs a source of energy, and that's what glucose is. Your blood has tons of glucose. Your body starts burning off the glucose in order for you to function normally, and that's what happens when you do fasting. And of course, if your body has too much glucose, then you can actually get rid of it while you're fixing the actual problem. So treating the underlying cause is important. And then what's sort of exciting is that there's some very recent research that even for any type of kidney disease, including things like glomerulonephritis, so not related to diabetes, you can potentially sort of reduce the damage that's being done to the kidneys as well through this fasting mimicking diet. This data is very, very recent and very sort of preliminary, but points to a very exciting sort of potential, not just for treating the underlying cause, but just to treating the kidney disease, the kidney damage itself. If you cut yourself after the bleeding stops, you get this sort of red rim around where you cut yourself. That's inflammation, and that helps bring healing proteins and stuff to stitch it back up. The problem is when you have excess inflammation, you're not supposed to have all this inflammation in your bowels or in your kidneys or in your anywhere else that you're not supposed to have it. So if there's a way to sort of tone down this inflammation, it actually can be immensely powerful.
Why would you do a fasting mimicking diet over doing fasting?
5-day fast with nothing but water sort of thing is not the easiest thing in the world to do. You get hungry, basically. So if you can make fasting still preserve sort of 80% of the benefits, but make it 50% easier, well, that's a pretty good trade-off.
That look at the power of fasting to reduce kidney damage and to generally enhance kidney health may at your time of viewing this already be published. You can check the top of the comments and also the description below to see if a link to that video has been added there. My earlier video with Dr. Fung on reversing type 2 diabetes is also there. We've looked at the primary diabetes and high blood pressure causes of CKD, how level of creatinine in the blood is used to diagnose it. We covered CKD prevention, like low-carb diet, and treatment, including the herbal formula Eefooton, showing potential to slow CKD progression when used alongside conventional treatment. If you found this video useful, I invite you to share it even with just one person who may benefit from its insights. You can do that by clicking the share arrow below. Up next, discover the benefits of sunlight beyond vitamin D, as well as the best and safest times to get sunlight. Find the link to that video at the top of the comments and also in this video's description below. It's been great to be with you. I'm Brendon Fallon, and this is Vital Signs.